Welcome to Spine 360 Conclave. In this short video, I'm going to set the background to this entire meeting. Sit down, relax, and know more about your spine. Back and neck pain accounts for the second most commonest cause for hospital visits worldwide. 8 out of 10 people will suffer from an episode of back pain after 40. So is it not important we think about this? Well, the good news is 95% of back and neck problem is not so serious. Only 5% of problems is serious, which may need attention. Some of the serious problems are disc prolapse, cancer, infection, fractures, and genetic. Well, today we're not going to discuss about the serious problems, and you can leave that to your spine surgeon to give you a solution. Now let's talk about the 95% not so serious problems as to what causes it and what it may be due to. It might be due to a sedentary lifestyle, minor injury, poor posture, and poor physical fitness. It may also be due to sports injuries, smoking, sitting jobs, and stress. Now let's understand where the pain comes from in your spine. The spine is made up of 34 vertebrae, which consists of the cervical, thoracic, lumbar, and sacrococcygeal. Each vertebra is made of 2 joints and a disc which are supported by very strong ligaments in the body. The spinal cord and nerve are responsible for movement, sensation, posture, and various other important functions which are protected by the bony spine. The muscle attachments in the spine need to be very strong to support it. Pain could arise at micro levels. It could be at the bone, the joint, the ligament, muscle, or at the nerves. Even the best of doctors cannot pinpoint where exactly the pain is coming from. Everyone here is at risk of developing back and neck pain from the day-to-day activities that inflict injury to the spine by lifting, twisting, or bending. Children are at risk of developing back pain because of the heavy school bags and the minor falls they develop in school. Women who wear prolonged high heels, carry heavy handbags, and during pregnancy are also at risk of developing back and neck pain. The elderly also develop back problems because of weak bones, osteoporosis, reduced activity, and prolonged sitting. Now, what do you do when you develop back and neck pain? You panic, you worry that something is seriously wrong, and you search for a remedy. You go on Google, you talk to a friend or a family, you visit your local doctor, meet a physiotherapist, or go to a fitness center. Sometimes self-help works, but not always. Then you are confused as to who you should see, whether an orthopedic surgeon, a neurosurgeon, or a spine surgeon. When you see one of them, you may have a period of bed rest, medication, belt and collar, some gentle exercises to reduce the pain. If it doesn't settle, you may require an X-ray or an MRI. Sometimes the scan may show degeneration, which is the normal wear and tear process of the spine, and it doesn't mean it's serious. Now, you are stuck with a situation where you have no serious problem, you don't require surgery, but you're suffering from pain and you're shopping around for a solution. You meet various people along the chain, like doctors, physiotherapists, and specialists in yoga, acupuncture, Ayurveda, and other traditional treatments. You get conflicting news, you're totally lost, fed up, and sometimes give up and suffer. Now, you're going to listen to lots of myths from people around you, whether to be active or take rest, to work or not work, two-wheeler or four-wheeler, to wear a belt or not wear a belt, to use a pillow or not use a pillow, to lie in a bed or lie on the floor. Also, about what lifestyle to follow, whether alternative therapy is good or bad, and what about sex and pregnancy. So these are the questions that you have to ask to yourself. In this conclave, we will discuss about all these issues and give you solutions and action plans for a healthy spine. The major part of the treatment should be focused on education, awareness, and how to manage and know the limitation of each of these treatments. It is your spine, it's your problem. We are here to try and help you to take control because you only have one spine. I hope when you leave today, you will be more confident to face your back and neck problem and also guide others who you may come across. Thank you.